Hey, Dr. McCoy. I'm in our Greenville OR today, and we're actually going to show you a live egg retrieval. So the patient is already asleep. They're heavily sedated, pretty much the equivalent that you would do if you were having a colonoscopy or a bad wisdom tooth extraction. The first thing we do is just rinse out the vagina with water, and then these are retrieved through a transvaginal ultrasound, like many women will have beforehand. But we have what's called a needle guide. It's a little metal guide that actually lets us guide the needle straight down the ultrasound so we can see exactly where we're putting the needle. This is the needle we're using. It does look really long, but only a small amount actually goes inside, because this slides down. And once I get it in place, I will pierce this through the vagina into the follicle that we see. And I can actually see this on ultrasound. There's little marks on it that help it show up a little bit better. And that lets me apply a suction. And I have a suction pump with a foot pedal, and that lets me apply the suction, and we withdraw all the fluid. And the eggs are floating in that fluid. They go in these little tubes, and then our nurse will carry the tubes into our embryologist, who will then search through it. So we're going to go ahead and get started. So on the ultrasound, we can see the patient's uterus is here, and this is her left ovary. She's got a lot of healthy looking follicles, and over on the right side, a lot of healthy follicles here. So we're going to start on this side. The needle comes in at a certain location. So just from having done this a lot, I know exactly where the needle is going to pierce. So we'll start, and you'll be able to see the needle come in right there into the first follicle. I'll then activate the pump, and it will withdraw that fluid. And then I'll just redirect it into the others. So most of the time I can retrieve all of the follicles just through a single puncture in the vagina, though sometimes you have to go into it more than once. So you can see that follicle collapse down. And over here on this tube, so this is the fluid that's coming out. Turn that light this way. So by shining the light on it, you may be able to see there's little particles floating in there. And those particles are the granulosa cells and actually have the eggs within them. So she will take that and give it to the embryologist. And then we'll keep repeating this until all the follicles have been empty and drained. So the embryologist pours it into a little dish, and under a fairly low-powered microscope, she is searching through. And the eggs are actually surrounded by a cloud of cells, the cumulus cells. So she will call them out to me and kind of count them out, so I kind of know the progress that we're having. And sometimes I'll aspirate a few follicles in each little tube. But that's the process. And then they will rinse the cells off of the egg a little bit later this morning. And the partner is giving a sperm sample now. And so then we will fertilize them. So once we get the eggs, we don't know anything about them today. All we'll know is just how many eggs we have. You can't judge the quality of them. Not all eggs will be mature. And so once they strip them down from the cells, they'll be able to tell if the eggs are actually mature or not. And then they will fertilize them with the ICSI procedure that I've previously shown. And then tomorrow they will know how many of them were actually mature. The patient will get an update in her portal, and she'll know how many of them actually fertilized. And then we will culture them till the 5th and 6th day into the embryo stage. And then they will get frozen. And some patients, if they do genetic testing, will do it at that time. So that's our process. So we will continue this. It generally takes about 15 minutes. Once she wakes up, generally in about 20 minutes from waking up, she will be wide enough awake that she can walk out of here. Most women say they're pretty sore. The bloating persists for about 5 days, and it starts to get better. And she'll have a period in about 10 to 12 days later. And by that time, all the hormones are back to normal. She could return back to work tomorrow, though she'll be a little sore. So if she wanted to take the day off tomorrow, that's not a bad idea. But I hope this gives some insight in the processes we take. Thanks a lot.